Let's start. My name is Dr. Muhammad Waqas Shahzad. I have recently passed my PLAB 2 exam. The purpose of this session is just to give you guys orientation regarding the exam, its pattern, its stations, all of these things. So at the end of this session, we will be covering these topics: UKMLA versus PLAB, what to expect on the day of your exam, how the exam process works, assessment criteria, additional assessment criteria, distribution of stations, how to start preparing, recommended notes, best academies, 3-month preparation strategy, and the best time to the UK for academy and mocks. And at the end of this session, we will be discussing some questions from you guys. If you guys have any question, you can ask me at the end of this session. Up till now, I will request all of you to kindly mute your mic. Just listen to me what I am trying to say here. So let's start. We will start with UKMLA versus PLAB 2. So a lot of you guys must have heard the PLAB 2 has been changed to the UKMLA, and it's actually quite confusing for you at the moment. So let me reassure you at the moment, because I myself did the UKMLA part 2. So at the moment there is no difference between UKMLA and PLAB 2. I would like to repeat it again. There is no difference between the UKMLA and PLAB 2. The only difference between both of these exams is just the administrative one. By that I mean is, the difference you will notice is just in terms of managing the exam. That is not actually related to you. So for example, just before the transition of UKMLA into PLAB and PLAB into UKMLA, the result of the PLAB 2 probably takes around 1 month and 1.5 months sometimes. But after this transition, the results are coming out very quickly. So you guys can expect your PLAB 2 results in 2 weeks instead of 4 weeks when it was PLAB 2. So apart from this, everything else is exactly the same. I hope you guys have understood. UKMLA and PLAB 2 is same, the station are same, the notes are same, the mannequins are same. There is no difference between these two. So I myself did the UKMLA part 2 and it was actually quite similar to PLAB, so there is no difference at all. So you guys don't have to worry about the preparation regarding these tools. So you guys have already know that what is PLAB and what is UKMLA. PLAB stands for the Professional and Linguistic Assessment Board, and UKMLA is United Kingdom Medical Licensing Assessment. So both of them are same. This is basically the second part of the exam you have done already. You have done the OET, then the PLAB 1, then the PLAB 2. After that you will get your GMC registration, inshallah. So yeah, this is all about the UKMLA and the PLAB 2. Now we'll be discussing about what to expect on the day of your exam. So in this section I'll be walking you through the process on the day of your exam, what will happen exactly on your day of your exam. So when, for example, when you book your exam, in your booking confirmation there will be 2 centers, Manchester Square or Manchester Street. So both of them are actually quite similar. There is no difference between the simulation and exam process in these 2 centers. So both of them are same. So what will happen is, on the day of your exam you will go to your exam center, which is either a street or square. Both of are literally the same. There is literally no difference between them. So when you were there on the day of your exam, so they will ask you to kindly stay in the waiting room for some time. So at first you guys should know that they will give you a reporting time. The waiting time, what is the waiting time? For example, on your PLAB 2 confirmation booking there is a reporting time. For example, in the morning it is 8:30 and in the evening it's probably around 11:30. So let me tell you guys, these are the things no one will tell you. When you enter on the day of your exam at your station, they will take 1 or 2 hours just in order to make you guys understood the process, just some registration and verification, and all of this process will take around about 2 hours. So those of you who have exam in the morning and the reporting time is 8:30, the exam will start around 10 and 10:30. Similarly, in the evening, if your reporting time is at 11:30, the exam will start probably around 1 and a half. So it's not like the reporting time is 8:30 and exam will start exactly at 8:30. So they will take a lot of time. They will take 1 or 2 hours just to do some kind of registration, some ID checks, some photographs. So all of your adrenaline rush, all of your preparation strategy will go in vain because you guys have to stay there for 2 or 3 hours just sitting doing nothing. So this is what will happen on the day of your exam. So you guys have to be mentally prepared about it. The exam will not start at 8:30. It will take 2 or 3 hours just to start the exam. So for example, your exam is in the morning at 8:30, and now it's like 10 and 10:30, and now it's your time to actually start the exam. So what will happen? They will make long queues, and by that I mean is they will arrange you in some sorts of line on the basis of your roll numbers. Then they will drag you into the circuits. What are the circuits? Circuits are basically 18 stations of the PLAB tool. So they will drag you into the circuits and they will arrange you on the basis of your numbers in front of the rooms. At that time they will not allow you to start the exam or start the station. What will happen is that they will start the timer. They will let you know that yeah, you can start looking at your station now. So let me tell you about the setting. There will be 18 rooms, and inside room is a patient, then the examiner, and then you. Outside the room there will be some tasks that will look like this. So outside every room, 18 rooms, for example, in each circuit there are 18 stations. 2 of them are rest station, 16 of them are normal station in which you guys have to perform something. So in the 16th station there will be a task which will look exactly like this outside every cubicle. So before entering the cubicle, you guys will have to look at this task and you have to do it in 1.5 minutes. So you guys will be given 1.5 minutes to look at this task. In this 1.5 minutes you have to look at this task, and then the bell will ring that you have to enter the room. So the bell will simply say enter the room or begin. So when the bell ring, all of you guys will enter the room. When you enter the room, you will, first of all, what you guys need to do is you need to observe what is inside the room. If you see any table, any mannequin inside the room, so you guys should mentally prepare yourself that it's not a history station, it's an examination station. So these are the few cues and tips you guys should know when you enter the cubicle. You guys have to understood and observe the surrounding in which you are actually entering. So for example, it's not an examination station, it's a simple station. When you enter the cubicle, there will be a patient in front of you, and there will be an examiner who is sitting beside the patient. So what you need to do is you guys have to sit on the chair in front of the patient and start your station. Examiner won't say anything to you. Examiner won't say anything to you. I am repeating this again. In these 8 minutes you'll be just talking to the patient. So everything you do, everything you say will be between you and the patient. There will be no discussion between you and the examiner. Okay guys, so the examiner sitting there will be just assessing you on the basis of conversation you are having with the patient. So for example, you have done with your one station, then you'll come out of the cubicle, then you'll have another 1.5 minutes to look at the task of the other station. So the exam will go like this, like you have to move from one station to another, then to another, then to another, then complete the 16 station. Two stations will be the rest station. It can be random, it can be anywhere between 6, 7, 8, anywhere. It's totally random guys. So the purpose of telling you guys all of these things is to just to in order to familiarize with the process how the exam will work. So you will have 1.5 minutes to look at the task outside the cubicle, then 8 minutes to actually perform your task inside the cubicle. So there will be just one more thing I would like to mention. When you are inside the cubicle and you are talking with the patient, and the 6 minutes have passed, they will give you an alarm for this. For example, you are talking with the patient, they will ring an alarm saying 6 minutes have passed. So you guys should know that there will be just 3 bells. First bell is to begin, that will start your 1.5 minute looking the task outside the cubicle. Second bell will be the enter the cubicle. Third bell will be the 6 minutes gone, 2 minutes remaining, and the fourth bell will be the move to the next station. These 4 bells will happen on the day of your exam on one single station. I will repeat it. First bell to begin, 1.5 minutes to look at the task outside the cubicle. Then the second bell will be to enter the cubicle. Then the third bell will be the 2 minutes remaining, and the fourth bell will be the move to the next station. So this is how they will simulate the whole examination purposes. So I hope you guys have understood up till now the process of the exam. Now we'll be discussing about the assessment criteria of PLAB 2 or UKMLA 2. So guys, I am just referring this exam as PLAB 2 because it's actually the PLAB 2. It's not UKMLA 2. There is no difference in between these two terminologies. So it's simply PLAB 2 exam. Make sure it's simply the PLAB 2 exam. Okay, so as I mentioned earlier, there will be like 16 stations, and each station you will be assessed with some marks. So each station carry 12 marks. So how these 12 marks are divided? These 12 marks are divided into 4 major domains: 5 marks for the history, 4 marks for the interpersonal skills, and 4 marks for the management. So let me brief it a little. History means the patient has some complaints and you are asking some questions in order to get better understanding of the complaint of the patient. So this is all about the history, and the purpose of giving you all of these assessment criteria is to let you guys know the importance of every aspect. So 4 marks for the history, 4 marks for the management, and 4 marks for the interpersonal skills. So you guys know what's history, you guys know what is the management. All of you guys will have some sort of difficulty understanding what is interpersonal skills. Interpersonal skills means your skills in order to communicate with the patient, in order to deliver to the patient, and in order to listen to the patient. So these are qualities, these are verbal or non-verbal skills which you will be using throughout your consultation with the patient in order to deliver what you want to deliver to the patient. For example, let me give you an example about this. For example, a patient will come to you for some sort of abdominal pain, and you enter the cubicle and the patient is holding his tummy with pain. So most of you guys will they will do is they have already memorized the script, so they will start the station and asking about the history, blah 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 blah. So those of you who know that the history and the interpersonal carries the same mark, what they will do is they will acknowledge the patient. How they'll acknowledge the patient? They will acknowledge the patient by saying, I can see that you are holding your tummy. Is everything all right? Are you comfortable to talk to me? Would you like me to give you some painkiller first, or is it okay to have a chat first? So these type of skills are which we call as interpersonal skills. So yeah, 4 marks for the history and 4 marks for the interpersonal skill and 4 marks for the management. Guys, management is not your management steps. Its management includes your examination, your provisional diagnosis, and the management. Okay, so the 4 marks for the history, 4 marks for the management, and 4 marks for the interpersonal skills. I would just like to add one more thing in here. So if you are good at history, if you are good at management, but you are poor in interpersonal skills, there are high chances that the examiner will fail you. So guys, we were discussing about the assessment criteria for PLAB 2. So as I mentioned earlier that there are 16 stations and each station carries 12 marks, and these 12 marks are divided into history, interpersonal, and management, 4 marks each. So a lot of you guys must have been thinking what is the passing marks for each station. So let me tell you about it. The passing marks for each PLAB 2 station varies a lot. It depends upon the average score of the person or all the students on that specific date. For example, if the exam is easy, the passing marks will be higher. If the exam is difficult, the passing marks will be lower. So this PLAB 2 exam is not about how you perform, it's actually about how the others are performing as well. Okay, so if you perform very well, but the partner, the person who is sitting to the other room that is beside your room is performing better than you, then he's gonna pass and you're gonna fail. So it's not a subjective exam, it's a collective exam. So the assessment and all of these passing marks will depend upon your performance as well as the other person performances as well. So We are discussing about the assessment criteria for PLAB 2, 4 marks for the history, 4 marks for the interpersonal, and then the 4 marks for the management. So I think this is pretty much it about the assessment criteria. So let's talk about the additional assessment criteria. What is this criteria? The additional assessment criteria is actually this criteria is on the tab which is in the hand of the examiner. Okay, so when you are talking with the patient, when you are doing your station, the examiner who is sitting in front of you has some tab or mobile phone or laptop screen, and on those screen there will be certain sections like consultation, diagnosis, examination, finding issue, language, listening, management, report, and time. So when you are doing the station, the examiner will take on these assessment criteria. So if you are fulfilling these in every station, you will pass. If you are missing some points, the examiner will mark Y on that specific criteria. So when you receive your result afterward, it will look something like this. So they will assess you on the basis of your consultation, your diagnosis, your examination, your findings, your issues, your language, your listening, your management, your report, your time. So this is actually the criteria of every station of PLAB 2. So in your exam the station will be different, but the criteria, assessment criteria, will be the same. So some of these findings will lie in history, some of these findings will be in the interpersonal, some of these will be in the management. So the examiner will have the laptop and he will have criteria in front of him, and he will watch you and he will see you, and he will mark tick. If you are good at consultation, he will mark the consultation. If you are good at diagnosis, he will mark the diagnosis. So the purpose of showing you all of these things is to guys to let you know that it's not like you go there and you do the history, do the management, and you will pass. It's not like that. So your consultation should be good, your diagnosis should be good, your examination should be on point, your findings should be good. You must have purposely discuss the issues, your language should be good, your listening skills should be good, and your management should be good. So you can see here the management is just a single part of it. It's not like this management column will contain 4 marks. It's not like that. So the management will include the management, the examination, the findings, the diagnosis. Similarly, the history will include the consultation, the issues, the listening, and the report. And interpersonal will include all of these things. So guys, I was discussing that. So if you're good at history and if you're good at management but you are poor in the interpersonal skill, you will not pass the station. If you are good at interpersonal skill, if you are good at history and you are not very good at the management, the examiner will most likely pass you. So the whole purpose and the whole criteria of all these assessment will depend upon the interpersonal skills, and how you guys can improve your interpersonal skill is by practice. So you have to practice with different people around the world, you have to practice with the people in your academy, the people online. So all of this PLAB 2 exam is just about the practice. Guys, I am repeating this again, it's just about the practice. You guys have to practice everything, because let me tell you, so you guys, even though you guys have memorized the station twice or thrice, when you are in the exam outside the cubicle, the moment you enter the cubicle, you will forget everything. So at the moment inside the cubicle, it will be just you and the patient. You are the doctor and the person in front of you is the patient. So your every knowledge, cramming, reading books, and memory will flash in a second, and you won't remember anything. So the best technique and the best strategy to ace PLAB 2 exam is to practice. But you will practice with your friend will be in your mind, and you will drive the station just like this, the way you practice with your friend. It's very simple, it's very easy, nothing to be complicated, it's not that difficult, honestly. When you guys understood what this exam is, you guys will thank me. Yeah, it's nothing, honestly, it's not that difficult. When you enter the cubicle, when you done with the whole 16 station, when you're coming out of the examination station and in the exam center, you'll be saying that yeah, this exam is not that difficult. But the preparation time, the strategy to pass this exam is actually quite difficult. So this is all about the assessment criteria of PLAB 2 exam. Now we'll be discussing about the distribution of 16 stations. So as I mentioned earlier, your exam will have 16 stations. So I will divide these 16 stations into two types. One is the history and counseling, and the second one will be the practical stations. So history and counseling stations means in this station you have to take history from the patient. Like the patient will be having some kind of complaint, and you will be taking history from the patient, then making a diagnosis, and then telling the management to the patient. So the major portion of PLAB 2 exam, approximately 10 to 11 station, will be from history and counseling. And the second part, which is called as practical station, in this station you have to actually perform some things. For example, in procedure you might have to perform some procedure like IV cannulation, catheterization, IV line, subcutaneous injection, IV injection, things like that. There are different procedures. So ABGs, yeah. So in the practical station, you guys will be performing some procedures: Simman, teaching, examination, prescription. All of these stations will be related to something practical work. So you'll be doing these things by yourself. In the history station, you will be actually taking history from the patient and then telling the diagnosis and the management to the patient. So these stations which I mentioned here are the most common one. So in every PLAB 2 exam you will see all of these stations similarly like this. So in every PLAB 2 exam there will be a station of BBN. BBN stands for breaking bad news. So in every PLAB 2 station there will be a single station of breaking bad news. In this station you will just have to break a bad news, for example cancer diagnosis, to the patient. The second station will be the medical error. In this station there will be an error which has been done on a part of your colleague by yourself, and you will be explaining this error to the patient. Colleague related scenarios are related to some problems related to your colleagues. For example, you are F2, you are working as a doctor F2, and your colleague who is F1 or some junior doctor has also has done something wrong, and now you have to advise your colleague about it. The fourth scenario is ethics. In the ethical scenario, we'll be counseling the patient. The fifth scenario will be NAI and abuse. This will be the abuse related scenario. Then there is an LGBTQ related scenario. So then there will be ENT, peds, derma, psychiatry, gynae. So you guys can even divide history and counseling into two parts. One is the counseling part, and second one is the second one is the medicine part. In the medicine parts, it's ENT, peds, psychiatry, derma, gynae. And in the counseling part, it's BBN, medical error, colleague related, ethics and abuse, and LGBTQ. So you guys can take screenshot of this if you want. And in the practical station, procedures, Simman, teaching, examination, prescription. So as you guys can see, there are total of 16 stations. Yeah, so you guys must have thinking that the history and counseling is more important than the practical one. But let me tell you guys, if you guys have passed all of these 5 practical stations in your exam, there is 99% of chance you're gonna pass the history station as well. But if you guys have passed all the history and counseling stations, but you guys fail these procedure and teaching and Simman, there is a higher chance of getting failed in the exam. So the practical stations are less in number, but they are quite important. So the one more thing about the practical station is these practical station will be in every exam. Every day you will see a Simman, every day you will see a prescription, every day you will see examination. But about the history station, one day you will see 2 BBN, 1 medical error, 1 medical error and 2 colleagues. It will vary like this. But practical station will be permanent. Every day you will be seeing one practical station daily. So this is about the distribution of 16 station in your exam. So yeah, that's pretty much it. Let's talk about how to start preparing. So this is the most important slide of our whole session, how to actually start preparing for your exam. So all of you guys have booked your exam up till now you guys are confused how to actually start preparing for it. So let me tell you about it. So guys, first of all, you guys should have a booking date of your exam. First book the seat. So for example, your seat is in October, November, December, whatever the date is. So you guys at first book the seat, then start preparing. It's not like you start preparing then book the seat, because you will be, you know, uh, zone out, and you will be not passionate about it. You know, first book the seat, then think about preparing for it. So how to start preparing for it? Book the seat and choose the academy. So let me tell you about the academies. uh, First we will discuss about the notes, then we'll be discussing about the academies. So what are the recommended notes for PLAB 2? Guys, every note, every notes for PLAB 2 preparation is same. Literally all of them are same. Moshobi, All Days, Navanika, all of these notes are actually the same. What is different about these notes is their pattern. So what I would like to suggest you guys is take, because all of these notes are available in the PDF form, so you guys can have the copies of each of these notes in your mobile. Just read one or two cases of each one of them, and then choose whatever suits you best. There is no a single recommended note for PLAB 2, so all of them are literally the same. There is no difference at all in any of these. So for example, you guys opted for the Moshobi. Yeah, you can go for the Moshobi. Myself have read the Moshobi notes. You can go for the All Days note, you can go for the Navanika note. It all depends upon your preference, it all depends upon your reading and studying style. So whatever the note is, all of them are same. So choose any one of them, read one or two cases. If you think that, yeah, this note suits you, you can opt these notes. All of them are literally the same. Now talk about the academies. So regarding the academies about the PLAB 2, there is just one advice I would like to give you guys. For example, you are choosing some specific academy, just make sure the academy you are choosing is near to the accommodation you are going to live, because in the UK the most expensive thing is the accommodation, nothing else. The food is very cheap there, so the most expensive thing in the UK is the accommodation. So choose the academy which is near to your accommodation. For example, let's say you don't have any accommodation, so then what you're gonna do? So there are multiple academies for PLAB 2, like Moshobi, Samson, like Swami, Aspire, Common Station, DSR, blah blah blah. So there are multiple academies. What I would like to suggest you guys, even though you have opted for any academy, is it the Samson, is it the Moshobi, in the end of the day you have to study by yourself. You know, the academy, what the academy will do, they will give you some sort of online course for few days, like 10 to 14 days. They will arrange some online classes, but then you have to, you know, go through the notes by yourself. So no matter what academy you are choosing, at the end of the day it's you have to, you know, study by yourself. The academy won't teach you anything. What the academy can do, they can just provide you some sort of environment, because when you go to the UK 1 month before your exam, you will have, you know, the environment of the academy there. You will be seeing a lot of mannequins there, the Simman there, so you will be practicing with a lot of different people there. Then you'll take some mocks there. So the purpose of the academy for the PLAB 2 is just to go there and practice your practical part of this exam, like the Simman examination, teaching, prescription, then the mocks. So the academy purpose is just to give you orientation, help you in the practical part of exam. The history and the counseling part, you have to do it by yourself. And how you gonna do it? You have to choose one notes, then you have to go through all of these notes, and then you have to practice with one single study partner about these notes. Okay, so this is how the academies actually work for PLAB 2. There is not a single favorite academy for PLAB 2. Honestly, let me tell you about myself. I went to Moshobi Academy, and what I thought was, when I went, well, I will go there, they will teach me this and this and this. But honestly, when I went there, when I went to the academy, I haven't seen Dr. Moshobi for once in my whole 1.5 months while I was staying at the academy. So in the academy, they won't teach you anything. So they will just give you the rooms to practice, and they will arrange some mocks for you, but they won't be teaching anything to you. They won't be mentoring you. They won't be telling you anything. So it's just about you. So you have to prepare everything by yourself, and then you have to practice it with a partner, and then you have to do the mocks and do all of these things. So this is all about the academies. So let's talk about the 3-month preparation strategy. This is what I used, and this is what I would like to suggest you guys to go for it, because right now you guys have booked your exam. Now you have thinking how to actually start preparing for it. So let me tell you. So you will divide it into 3 months. For example, in the first month you will go through any notes. It could be Moshobi, All Days, Navanika, Aspire, anyone. Go through any of these notes and attend some lectures. Which lectures? The lecture which will be given by the academy you choose, and do some online mocks. Online mocks means practice with the person who has already been familiar with the examination purpose. He will give you the feedback regarding how you are performing. So during the first month, go through the notes, read all the notes, don't cram it, just read it, take the lectures which will be given by your academy, and do some online mocks. What are the online mocks? It means like you are practicing with someone who has experience. For example, if some of you guys are practicing and going through your mocks and lectures, and they don't have any person to practice with, you guys can message me, and I will arrange some online mocks for you as well. So in the first month, in 1 month, you will be going through the notes by yourself. In the second month, this is a trick, and this is a trick part of whole PLAB journey. You will take Lowan. What is Lowan? Lowan is basically a teacher who teaches PLAB. He teaches everything related to PLAB in 5 days. So, but the problem is, if you take the Lowan class from the start, you won't understand anything, because it's a master class. Master class means you guys should have some background knowledge, because the strategy of Lowan, he corrects your mistakes. So if you guys don't know anything, what's the purpose of taking Lowan? So my advice is to go through all of your notes by yourself during the first month, and in the second month take the Lowan. When you take the Lowan, it will cost you around about 80 pounds, and it will be a 5-day course, and the Lowan will teach you everything in 5 days via Zoom meetings. So he will teach you everything via the Zoom. So first month for the notes, second month for the Lowan, and because Lowan is just 5 days, so in the second month, probably in the last week of the second month, you can study practical station by yourself. I'm telling you to study, not actually practice, study. So for every practical station, like prescription, Simman, examination, there are some certain books available. So if you guys need it, I can send it to you in the group as well. So don't worry about that. So just take Lowan and study practical station. So first 2 months will be the things you are actually doing before coming to the UK. So before coming to the UK, you have to go through all the notes, you have to attend all the lectures, you have to take Lowan, and you have to study the practical station. You guys must do all of these things before coming to the UK. So this is a strategy about the first 2 months. In the third month, you will go to the UK, and you will follow the last month's schedule. So what will be the last month's schedule for you guys? So the last month's schedule, let me tell you about it. For example, so if you guys want to write it, you can write it. For example, you guys have gone through your notes, you have taken the Lowan, you have studied the practical station as well. So it's the last month before your exam, and now you are in UK, and you guys don't know what to do. So let me tell you what you're gonna do in the last month. So in the last month, when you go to the UK, you will wake up every day. You will, first of all, you will book an accommodation, and you will visit the academy, things like that. So I'm going to tell you your everyday routine in the last month. In the last month, what I would like you to do is wake up early in the morning, write 2 or 3 prescriptions daily, then take your breakfast, then start getting ready to go to the academy. Then you go to the academy. When you go to the academy, what you need to do is you need to spend 2 or 3 hours by practicing practical station. What are the practical station? Simman, procedure, examination, and then the teaching. These are the practical stations. So daily 2 or 3 prescription in the morning, then go to the academy. In the academy, practice 2 Simman, 2 examination, 1 procedure, 1 teaching daily. So during the last month, all of this thing will take like 4 or 5 hours. Up till your lunch you will be finished with your practical station stuff. So rest of the day what you need to do is you will revise the Loan, you will revise the notes. Then there is another thing which we call as recalls. What is recalls? Recalls are the file which are made by the students. It's just like the remembering the exam. So these are the files which are made by the students. So on, for example, on the 21 of June what stations came, on 22 of June what station came. So basically what you're going through, what you can call it as past paper simply. So in last month of the UK you have to do the prescription and practical stuff daily, and in the rest of your day you have to do the your Loan and your notes, and in the end you have to take the recall and study the recall. So this is how you're gonna do your exam. It's very easy, it's very simple, it's nothing to be worried about. Yeah, I know it's kind of complicated because you guys are not bit oriented at the moment, but you will guys know everything, you will guys understand everything with the time. It's nothing to be worried about. So this is all about the 3-month preparation strategy about the PLAB 2 exam. So if you guys really want to take a screenshot, if you can take it. So yeah, so regarding the last slide, it's about best time to go to the UK for academy mocks. As I mentioned earlier, it's 1 month before your exam. For example, your exam is on a specific date. It could be November, December, October, whatever. So you have to go to the UK 1 month exactly before your exam. So in this 1 month, what you need to do is I have told you earlier about the last month's schedule. So this is what best time to go to the UK. Yeah. So now it's time for the question and answers. So if you guys have any questions, you guys can unmute your mic and ask me one by one. I'm here to answer. Oh, that's a very good question by Halima. Can you share why candidates fail? PLAB 2 has a very less passing ratio than PLAB 1. Yeah, so it's a very important question. Let me tell you about it. About the question of Halima, yeah. So let me tell you why most of your guys, most of the people fail PLAB 2, not PLAB 1. So actually, PLAB 2 is a very complicated exam. At first, it's a talking exam, so you have to talk, you have to deliver, you have to take the history from the patient, you have to do the management. So all of these things, the history, the management, and the examination and the aidment, is very overwhelming. Even though you guys know everything, on the day of your exam you will make mistakes, you will forget things, you will do blunders. So the first and the foremost reason why people fail PLAB 2 is they are not used to the UK culture. The bottom line is they are not used to the UK culture. The whole purpose of PLAB 2 is just to check either you are ready to enter into the UK healthcare system or not. So during your consultation, if the examiner sitting there, if he feels that this person is ready to be entered into the NHS, he will pass you. If he feels that this person is not ready yet, he will fail you. Why he will fail you? Because what we do is we just cram the things. As a Pakistani, I'm very sorry, I'm not hurting anyone. As a Pakistani, what our habit is to cram the thing. We just try to memorize everything, but it's not like that. You don't have to memorize everything. So what you need to do is you need to think and you need to deliver what's important for the patient, and you have to listen to the patient. It's not about that you have 8 minutes and you have to deliver everything to the patient and spit everything to the patient. It's not like that. So you have to actually listen to the patient. So you have to actually express the emotions, empathy and sympathy. You have to be up, you have to be down. So you have to actually make a formal consultation with the patient. It's not like you have to remember 10 points and then spit it to the patient. The reason most of the people fail PLAB 2 is because they cram the notes and they spit it in front of the patient, and the examiner will know that you are a scripted doctor because you are saying the things by reading the books. They don't want this from you. So this is the most important reason why people fail. about reading the notes? Should we just read or try to learn cases in order to know how to proceed with the history or management? So, Misha, my answer is that yeah, you don't need to cram the notes. You just have to read the note and practice with the person. For example, your study partner, he can be the patient, you can be the doctor, and practice with him. So just practice and try to memorize the things which can be done in 8 minutes. So put on the timer and try to memorize and complete the station in 8 minutes. So Aisha, sir, can you please tell about the Simman? So Simman is basically a mannequin, which is a simple a mannequin. For example, to simplify it, it's actually emergency patient. The patient is dying, and you have 8 minutes to actually save the patient. So what you'll be doing is you'll be performing A, B, C, D assessment, and you'll be managing the patient. This is all about the Simman. So Simman are some sort of emergencies. So it's actually a station in the PLAB 2. In when you enter the cubicle, you will see there is a patient lying on the bed. He will be attached to the monitor, and the patient will be dying. And you have to do some things in order to save the life of the patient. This will be the Simman. Can you please tell why people these days are not passing in first attempt? Which mistake should not we mistake we shouldn't do in the first attempt? So, Dr. Zar, it's a very complicated question to ask. There are multiple reasons most of guys fail. So I don't think so. I can finish all of this thing in just a single question. But as I mentioned earlier, the first and the most important mistake the students do is they become scripted. They just try to memorize things. And the second thing is the students are not oriented. They don't know what is GP, what is A&E, when to go to the hospital, when to go to the GP. So all of these confusions, you are not oriented, you are not speaking as a doctor. So all of these things leads to the failure of the patient. How should we study notes? To learn it or just read? And guys, study it, go through the notes, then practice it with someone. What is the amount of time we should be practicing with other people, like patient doctor station with other people? 1 month, 15 days? Guys, there is no specific time for it. The day you start practicing any station until the day of your exam, this is the window you're going to be practicing. So practice as much as you can from the start, from the day of your preparation, from the day when you start preparing for the PLAB 2 until the day when you're done with the exam. Can you please share Moshabi notes? Yes, I can share Moshabi notes. Ask this question in the group. I will share the notes there. Since there is only one bell at 2 minutes remaining, how to develop the insight to complete the station within that time? So that's a very good question at the start. So after you'll be practicing stations frequently on a daily basis, you will feel the 6 minutes have gone, 8 minutes have gone, 7 minutes have gone. So what you need to do is you need to make your own notes to to write the summary of every station, which things are important, which things are not. For example, let me tell you, in every history station, what you need to ask is you need to explore the presenting complaint, you need to ask the associated symptoms, you need to ask the red flags, you need to ask the complications. These are few things which are important in the history. Similarly, in the management, you need to know either you have to admit it or you are discharging it. You need to know what's the best investigation for this patient. You need to know what's the best management of this patient. So after continuous practicing and after simulating with your friends, you will know when there is a 6 minute bell. So even though, let me tell you, even though you are not able to finish your station, there are still chances that you will pass it on the basis of your history and your IPS. So it's not like that you will have to complete the station to pass it. You can pass it even without completing it. In practical station, do we vocalize everything as we do? Who do we address, examiner or patient? So we'll be addressing the patient, not the examiner. We won't be interacting with the examiner. There are stations in which we have to interact with the examiner, but please bear in your mind we'll be interacting with the patient. For example, we are examining, so what we be doing is, so let me give you an example of an abdominal examination station. So for example, you are about to perform abdominal examination, so you will explain the purpose of the examination, the purpose, the position, the exposure, all of these things. After that, what you will be doing is Okay, Mr. Smith, now I'd like to examine you. For that, I will ask you to kindly uncover yourself and lie flat on your back on the bed. So, okay, I can see that you have uncovered yourself. Now I'm going to uncover you. I'm going to touch you. If you feel any pain, just let me know. Similarly, just like this, you will, perform the inspection, then palpation, then percussion, then auscultation. But don't verbalize the positive or negative finding. Just do it. So it's important to do the step instead of verbalizing it. So they won't give you mark for verbalizing, they will give you mark for actually doing it. So I think that's pretty much it. Is there any other question, guys? If you guys have any other questions, you guys can ask.
Yeah, I have a question.
Yeah. So actually, Farhana, it's the station in the PLAB 2 are not difficult. It's very easy. It's very simple. It's very straight. But the reason why most guys fail, even though they know the station, is that, so for example, if the patient is coming with the vertigo and he's having the nausea and the vomiting and the fever, flu-like symptoms 1 week back, you guys know it's vestibular neuritis. So the mistake the most of the people will do is they will just ask the questions related to the vestibular neuritis. So they will not ask the red flags in this condition. They will not ask about the stroke. They will not ask about the hearing problem. They will not ask about the complication. They will not ask about the driving. They will not ask about the work. Maybe the patient with vestibular neuritis is scaffolder, and there is a risk if he keep on doing his work, he might die on the workplace. So the reason most of guys failed is because they know the station, they know how to actually do it, but they will keep on surrounding around the vestibular neuritis instead of asking the other question. So my advice is all of you to you is that even though you know the station, even though you know from the first question it's vestibular neuritis, just keep on acting that you don't know it. So in that way you are giving the message to the examiner that you are struggling, that you are trying to rule out the things. You are not a scripted doctor. So yeah, the exam, the all of these things is not that difficult. You will know the station. You will know the station while standing outside the cubicle, but there are high chances you will fail it because you will act scripted in this station. Okay. Any other questions?
Thank you.